Uh, Vincent, go ahead and do this one. Vincent?
Vincent's not here. Vincent's not here.
Okay, Ivan, go ahead.
Namo Fundamental Teacher Sakyamuni Buddha. Namo Fundamental Teacher Sakyamuni Buddha. Namo Fundamental Teacher Sakyamuni Buddha. The unsurpassed, deep, profound, subtle, wonderful Dharma in 100,000 million eons is difficult to encounter. Now that I've come to receive and hold it within my sight and hearing, I vow to fathom the thus comes one's true and actual meaning.
Okay, thank you. Let's quickly do 1 minute meditation. Then we start before we start the section. Okay. So keep your back straight, your neck straight. Close your eye. Inhale and exhale to the nose. You count 1. Inhale and exhale to the nose. You count 2. If you see your monkey mind, go back to your inhale and exhale and counting. Don't hold your breath. Just do naturally. Um, if you lose track of your counting, just stop from 1. All right. Um, okay. Let's do that. All right. Sit still and close your eyes. Okay. All right. Thank you. Okay. Let's get started. Um, um, see. Okay. Last time we are here. Okay. So we learned about different study on different methods. So to compare to see which one is um, better. So there are 3 different methods that we learned last time. It's the anti-depression medication. That is the first one. Basically, for that, usually that is very old tradition. The old method. Because basically the brain is the chemistry in the brain is imbalance. That's why we have a lot of depression or anxiety or whatever relate to emotion. So and therefore they use that medication to balance the chemistry in the brain. But if they use too much medication, it won't help. It will even worse. So they also have the other method. This is also the old classic method they call the psychotherapy. Psychotherapy. It means that each section the patient come and talk to them, and they will train the patient how to express all their emotionally. Doesn't mean that the psychologist give them the medication. No. So this is another method. But these 2 methods here, these 2 methods here, yes, it helped the depressed the patient to be able to calm them down, and also to be able to get out, recover from the depression. But not too long later on in the future, it will also relapse. That means it come back again. So this is not the permanent solution. um, Tammy, what else we learned last time, Tammy? You know?
I'm not sure.
Mm.
I don't remember exactly everything.
Okay, that's good. So basically, the third method they call the the cognitive therapy, or the cognitive behavior therapy. They call it CBT. That is the abbreviation of cognitive behavior therapy. So basically, this one right here, the most important about is right now the science, the psychologists, they know that um, um, the depression comes from the mind, right? Come from the thinking. If we have too much negative thinking, therefore we will have the negative feeling, and of course we will have depression, and that's what that's what they call the cognitive distortion, right? The cognitive distortion, that means the negative thinking, and what they do is they come up with the cognitive therapy or cognitive behavior therapy to try to help the patient to transform the negative thinking into positive thinking, or from the pessimistic into the optimistic. That's important. And you know what? The outcome of the study for this is it's wonderful. It's much better than the other two classic methods. That means the antidepressant and also psychotherapy. Because when they use this method, they be able to see that the chemistry in the brain, right? It become balanced even without medication, and that is the breakthrough of the psychologist. It's really wonderful. This is you know what? A lot of patients, they don't like to take medication because medication always have the side effect. That for sure. And a lot of them, yeah, a lot of them are afraid. But so this is the good one. So they don't have to take medication. Okay, so that is the three different. Um, okay, so what we did also learn is uh, they divide two groups, right? The first group is called the antidepressant with medication. Antidepressant medication, that means the patient will using drug, right? And they also do the study with they do the study. It's two different groups, right? They call the first one they call intermediate. What do they call intermediate? I forgot. Okay, intermediate bioleotherapy. What is the bioleotherapy mean? Is basically this is the combination of psychotherapy and also the cognitive cognitive therapy. It's called the self-help, right? Self-help. By or therapy, it means that they give the patient the manual, and inside the menu, basically there are the instruction how to transform the certain negative thought into the positive thought. and that for the patient to do the homework before they can come and visit the next visit, right? So the first group, they give them the menu at the beginning, right? And the second group is at the beginning, they did the delay by Leo therapy. It means that this one right here, they will not give the manual or the self-help for the first 4 weeks. So when the second 4 week, they will give to them. After the 4 week, they will give to them. That's why they call the delay. At the beginning, the patient is depression is the same. But for the first 4 weeks, we see that the one who have the menu for the self-help, if we do rapidly go back to normal. That is wonderful. The reason this one is still remain because there is no treatment, right? There is no treatment for this group yet. Yes, every day the psychologist will call each patient and talk to them. And also, you know what, they use the BDI, that means the back the depression indicator, I think. Inventory. It means that there are 25 questions, and those questions tell the where is the patient is normal or mild or moderate or severe at the depression. So they based on that thing, they do the rating. So every day, I think the patient have to do the rating for themselves, right? So when the next visit they come and they will look at that and they will tell, okay, you are mild, normal, or moderate, or whatever. That's how they do. So when the second, after for the first 4 weeks, right? They give the second group the menu, the same menu, and you know what? After 3 months, and we see that they have very similar results. This is wonderful. So once they have it, the second group will begin to recover, just like the first group. It's no different, not much different after the 3 months. This is wonderful. And you know what? And in this study, they found that they follow up for 3 years, right? After 3 years, they also keep follow up to ensure that there any relapse. Relapse, that means the patient after they recover from the depression, do they come back? That means do they come back to the depression again? Look like the other two methods they do. That means the patient have a chance. That means they do. There a chance that for them to come back into the depression. But this one right here, cognitive therapy, or we call the self-help. This is important. The patient every time they have the emotion, right? They go up and down. That's normal. But whenever they have a negative thought, they can open the book and they can read it, and that's how they lift up their spirit. This is important. That's how they be able to get out and they no relapse. Does it make sense to you, Tammy?
Yes, that makes sense.
Okay, so this is important. So we have learned so far with that meditation. Okay, okay, we will continue on our study. Okay. Okay. Let's see where we at right now. What happened? Okay, hold on. Okay, let's do this. Okay, you can read from here. Let's see. Serena, you want to read from the diagnostic finding at the tree evaluation?
The diagnostic findings at the 3-year evaluation confirmed that 72% of the patients still did not meet the criteria for a major depressive episode, and 70% did not seek to receive any further treatment with medications or psychotherapy during the follow-up period, although they never experienced the normal up and
down. Now we all feel from time to time, approximately half indicated. Okay, keep going.
that one day that they opened up feeling good and reread the most helpful section. The researchers speculated that these self-administered booster sessions may have been important in maintaining a positive outlook on recovery. 40% of patients said that the best way to focus that it helped them change their negative thinking patterns, such as be less perfectionistic and to give up all thinking. It is good that we
Okay, that's good. That's good stuff right there. That's good. That's really good. Thank you. So basically, it's yep, we see that they follow the study using this method for self-help. Basically, the patient is even after 3 years, it's not relaxed. That means they not come back into the depression. That's a good news. That is very good news. So why do we need to learn all these things here? Well, it's not only for ourselves, but if in the future we know any one of our friend or family member, they have this kind of problem, we can help them, right, with our medication. That's important because we don't want our friends from family member or our loved one to be harmful to the mistreatment, right? That's important. All right, that's good. Okay. Houston, you read the next one.
Yeah.
Yeah.
It is good that we now have 3 types of effective treatment for depression: anti-depressant medications, individual and group psychotherapy, and bibliotherapy. Something like that. Speed recovery: 70% of therapists polled indicated speed recovery. 70% of the therapists polled indicated that they had recommended at least 3 self-help books to their patients during the previous year, and 86% reported that these books provided a positive benefit to their patients, the therapist. It appears that more and more therapists are beginning to assign
bibliotherapy to the patient at the psychotherapy homework. Okay, keep going.
hold on. Between therapy sessions in 1994, the results of the nationwide survey about the use of bibliotherapy by mental health professionals were published in the Authoritative Guide to Self-Help Books, published by Guilford Press, New York. Dr. John W. Santrock and N.M. Minute from University of Texas in Dallas, and Barbara D. Campbell, a research associate at the university, conducted this study. These 3 researchers surveyed 500 Americans mental health professionals from all 50 states and asked whether they prescribed the books for patients to read between sessions. Were also asked which self-help books from the list of 1,000 they most frequently recommended for the patients. Feeling Good was the #1 rated book for depressed patients, and My Feeling Good Handbook, published as a Plume paperback in 1989, was rated #2.
Okay, good. Okay, you understand what you just read?
Yeah.
Yeah, tell me what you understand.
They were making books to make depressed patients feel better.
Mm, yeah, that's right. Basically, it's these three researchers, right? What did they do? Okay, these three researchers, what did they do? Is they did research survey 50 states, 500 therapists. That means the psychologists, professional. They asked that whether they recommend the patient to use the feeling good book for helping the patient. Yeah, they said yes. So that means nowadays the psychologists use this as a homework. They call it self-help book as homework before the patient comes to see them for the next visit. That's why the patient be able to recover quickly, and also that's important. That's very important. This is the good method. Mm. Okay. We will continue on, and we and time to time we will come to the point that we will learn about. There are about 14 or 15 different type of negative thinking. So we will learn about those type, and we will understand what are they, and how do we address them. Okay, that's important. This is a very important teaching. Um, Okay, Victor, be the blue one and all the way.
Feeling Good, the New Mood Therapy from David Burns, MD 17. Chapter 1, A Breakthrough in the Treatment of Mood Disorders. A series of recent studies confirms that these techniques reduce the symptoms of depression much more rapidly than conventional psychotherapy, talk therapy, or drug therapy. The name of this revolutionary treatment is cognitive therapy. Cognitive therapy is a fast-acting therapy of mood modification that you can learn to apply on your own. It can help you eliminate the symptoms and experience personal growth so you can minimize future upsets and cope with depression more effectively in the future. The simple
Yeah,
effective
good. Stop right there. So, what do we know about this thing here? What do we? Victor,
oh, so there's like this new treatment called cognitive therapy, and it's like fast acting therapy, and it helps like uh your depression in the future.
yeah. Let me give you the negative thoughts so you understand certain type of them. For example, if a person who depressed and if the person who is looking for the perfected, right? So what happened if she got a B on the test, you know what? And she said that, oh my goodness, I uh, uh, could flunk my final, right? Something like that. So those kind of negative, it will killing the person easily. There are even I think you know what we can visit this. Let me see. See if we go to that point yet, or we can go. See. I think we can go ahead and continue on. So when we come to that, and we will explore to the negative thought, and we learn about different type, and the example from that. So we okay. Thomas. Thomas, are you there?
Thomas is not here.
What happened to him?
He's currently with he
Yeah. All right, Vincent. Go ahead and read this one.
Thomas is when Vincent's not here.
Oh, okay. All right, Ivan. Go ahead.
The simple, effective mood control techniques of cognitive therapy provide one, rapid symptomatic improvement. In milder depressions, relief from your symptoms can often be observed in as short as a time as 12 weeks. Two, understanding. A clear explanation of why you get angry and and what you can do to change your moods. You learn what?
Mm.
Causes your powerful feelings, how to distinguish normal from abnormal emotions, and how to diagnose and assess the severity of your upsets.
Okay, good. Stop right there. The okay, in this chapter here, we will go through the treatment of the mood disorder. So there here, what they provide here is this is a simple, effective mood control technique. For the one is mild depression, the relief from your symptom can observe in 12 weeks, right? And the second one is so basically this is the step that they do, and they will also try to understand what kind of mood that the patient have, and how do they deal with it. Right? How do they deal with it? That means they need to understand the cause of it, and also to distinguish the emotion is normal or abnormal. Later on, you learn about different type of 15 different type of, um, of thinking, negative thinking. So that also help us to identify them easily. And when we understand it, we can nail down that, right? The third step is okay. We will okay. All right. Third step. Okay. Hung, did I call you yet, Hung?
What did you say, Ty?
Did I call you yet?
I don't think so.
Okay. Do number 3.
Self-control. You will learn how to apply safe and effective coping strategies that will make you feel better whenever you are upset. I will guide you as you develop a practical, realistic, step-by-step self-help plan. As you apply it, your moods can come under greater voluntary control.
You understand what it is saying?
It's like saying that there's like ways to like control yourself.
Mm-hmm. So that means the first, the step number 2 is try to understand the cause of the feeling and know the different type of the feeling, and therefore the second choice is basically this author said that using his self-help guide will help us help the patient how to deal with their emotion, their mood, right? So they can be able to control that mood. Um, for example, when we get angry, we have to know how to deal with it. So the technique that we can handle it, so we don't get into trouble. We don't create we don't harm any relationship, right? With other. That's important. Okay, Quyên, read the next one. 4.
Oh, where do I start?
Number 4.
Genuine and long-lasting prophylaxis prevention of future mood swings can effectively be based on a reassessment of some basic values and attitudes which lie at the core of your tendency toward painful depressions. The author will show you how to challenge and reevaluate certain assumptions about the basis for human worth. The problem solving and coping techniques you learn from encompass every crisis in modern life, from minor irritations to major emotional collapse. These will include realistic problems such as divorce, death, or failure, as well as those vague chronic problems that seem to have no obvious external cause, such as low self confidence, frustration, guilt, or apathy.
Good. So what do we know? What do we learn from this thing here? So when we reassess the some of the basic value attitude of the mood, and that means it helps us to understand the painful depression. And when we understand it, and we be able to the problem solving and dealing with this kind of situation from minor to major emotion, right? So it will, and of course there are many problems in the world right now. It happens every day. Divorce, death, failure, value, chronic problem. Uh, and you know what? Sometimes it's low self-esteem and frustration. This is the thing that causes us to become the depression. Once we understand it, and we can be able to using the guide from this book here, it will help us to prevent and also grow. That's how we can be able to get out of this kind of situation. Okay. Uh, Ken, are you there, Ken? 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 John, are you there, John?
Yes, sir.
Good, read this one.
Oh, wait, like number 1 or chapter 1?
The whole thing.
Cognitive therapy principle. The first principle of cognitive therapy is that all your moods are created by your own cognitions or thoughts. A cognition refers to the way you look at things, your perceptions, mental attitudes, and beliefs. It includes the way you interpret things, what you say about something or someone to yourself. You feel the way you do right now because of the thoughts you are thinking at this moment. Let me illustrate this. Have you ever been feeling as you read this? But you might have been thinking cognitive therapy sounds too good to be true. It wouldn't work for me. If your thoughts run along these lines, you are feeling skeptical or discouraged. What causes you to feel that way? Your thoughts you create by those feelings, by the dialogue you are having with yourself about this book.
Okay, good. Stop right there. You understand what he said, right?
Yeah.
Tell me.
About like how your thoughts affect some. I don't really know how to explain it.
Okay. So basically, cognitive it refers to the thought, right? That means the depression comes from the way we think, the way we perceive, the mental attitude, and the way we believe. And you know what? Sometimes things happen. It's not too bad, but the way we interpret it make it terrible, right? That's why the psychologist said that If sometimes the thing has happened, the event it happened, it's not considered okay. Tell me.
Yes.
So, what kind of criteria that based on the event or based on the thinking that make us to become the depression?
The thinking. So
Yeah.
the event doesn't matter not that it doesn't matter at all, but you can always change how you see something or how you want to feel about it.
Okay. Sometimes the event is not too bad, right? But we make things worse. That's why the Buddha said that our unguarded thought is the most evil one. We have to because they harm us more than the enemy harm us. Okay, the outside enemy it harm us, but cannot compare to our unguarded thought. That means that the negative thought will harm us even more. That is very dangerous. We have to be very careful and to be mindful and from this you will understand how to transform your thought from negative to positive. That will help you to maybe get better. That's important. Okay. Okay, Tammy, go ahead and read this one. Conversely.
Conversely, you may have felt a sudden uplift in mood because you thought, hey, this sounds like something which might finally help me. Your emotional reaction is generated not by the sentences you are reading, but by the way you are thinking. The moment you have a certain thought and believe it, you will experience an immediate emotional response. Your thought actually creates the emotion.
No, so this did make sense, right?
Yes, the thought comes before the emotion. So however you think about things is how your emotions are going to follow that pattern.
Okay, that's important. So just like in the psychology, right? Let me you know what? Let me go here. Let me see. Let me go back here. Okay. 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 Let me. Can you see this model? Where are you? Oh, what happened? What happened? Right. Okay. Can you see this model, right? Amy, can you see it?
Yes.
Okay. So basically, let's say that if we are the depressed person, right? And we have a habit of getting angry, right? We easily get angry. When something says something, we get angry. And you know what? If he attend let's say that he said he heard someone say about that. You know what? The whole purpose of learning is try to transform the emotion, right? We need to know how to transform our negative emotion into positive, negative thinking into positive. Therefore, we be able to resolve a lot of problems. We be able to benefit from from for our life as well as the spiritual life. If a person who attend the Dharma lecture, right, and the lecturer who said this, and he did not mean that to focus on that person, but you know what? This person, when he hear about that, if a person who always easily get angry, and that will harm them more than help. And you know what? Tell me, what does that mean? What does that mean? When if someone is always get angry, right? If they in the meeting and the person who share that we should not, we try when the emotion come up, we try to see it and we try to transform it. Otherwise, if we let the habit of angry, that will harm us even more. When the person who have the habit of angry and they hearing this, what do you think about this person?
So they're going to get angry automatically. They're going to think something along the lines as the instructor is telling me I'm not thinking correctly. He's calling me stupid. He's trying to tell me how to think, and none of this is right for me. And they don't know what they're talking about. And just go on with the anger.
Yeah, but the teacher he doesn't mean that he did not mean that he focused on that person, but you know what, this person is make up all the story along the line, and that makes things worse. Okay, let's use in that scenario. All right. If the depression person who have a habit of angry, right? When he hear the instructor sharing about the bad habit of angry and try to help them to transform it using this model, okay? So if that person hearing that instructor, that means the ear contact, right? The instructor voice and the eye seeing contact the instruction person appearance, the physical appearance. That means the mind, the brain, right? Of that person, that means the depressed person will automatically pay attention to the what? To the voice and also to the physical appearance of the instructor. And when they pay attention, because in here, in the alaya consciousness, this is in Buddhism, what alaya consciousness means, it's the storehouse, it store everything that we take from the outside world into it. And we will, that means when you learn from school, you read, whatever you study, it will become the knowledge. And you know what, whatever good or bad from outside, we also store in here. If the person who have a lot of usually easily get angry, that means he have a lot of resentment or a lot of angry seed, right? The seed of anger here. And you know what, when he pay attention or she pay attention to the voice of that the instructor and also the physical person appearance, he, you know what, it's automatically it trigger the feeling of anger arrive very quickly, quick to the point that it will control the perception. It will control his or her perception, and you know what, she or he could not be able to think. Yeah. She or he could not be able to think, and what that means, it's not positive thinking. So what, it will be negative thinking. What kind of negative thinking? Oh, you know what, this person tried to teach me something, try to say that I would the bad person. You know what, he talked back to me, that means he said bad thing about me. Those kind of negative thinking will be in here, in that person's mind. And you know what? That's why. And you know, the volition, that means the 5 sense of the consciousness. It means it represents the mouth and the body. Okay, so that means the mouth of that person is maybe murmuring inside. That means talk to themselves, and the body, it's maybe it's not it's shaking or it's not peaceful, right? That means Even though they sit there, but they don't feel any peaceful. They are very tense. Okay, this is the worst scenario, right? Serena, you understand this model so far?
Not a lot.
What?
Kind of, not a lot.
You follow? Do you follow?
Kind of, not a lot.
No, kind of, not a lot. Okay, let me repeat one more time. Okay, pay attention. All right. The person who depressed, right? That means that person is usually get angry. If the instructor try to help the person who are angry, try to help them not to get angry. But when that person listen to that to the instructor, he or she thinking that the instructor try to say bad thing about her or he, and what does that mean? That means the depression person, well, his ear is contact. That means hearing contact. That means hearing the instructor voice, right? Hearing, that means contact. His eyes seeing the physical appearance of that person. That means his eye contact that physical appearance of the instructor. And you know what? And he or she automatically, his brain or the mind automatically pay attention to the voice and also to the physical person. Therefore, when you pay attention to those things, because in here, he already or she already have a lot of negative thinking in here, right? Therefore, the emotion of anger is arrive very quickly and become very strong to the point that it will control the perception. It will control the perception. And therefore, he or she cannot be able to think properly or positive. Therefore, what kind of negative thinking she has? Well, you know what? This person tried to say bad thing about me. This person tried to say that I work bad, right? Um, uh, and you know what? And due to those kind of negative perception, then that means this person will not. This is represent for the mouth and the body. The whole thing here is represent for the mouth and the body. That means the mouth is mumbling. That means it's talk to herself. And also the body is not sitting peacefully, get very a lot of very tense. Okay. That means when she, even though she still sit there, right? But her body and her mouth is not in the state of peaceful. Okay, it's a lot of what do you call an emotional in the emotional state, very emotional state. Does that make sense to you, Serena?
Yeah.
Okay, now we can use this thing here to for the to help the depressed person to go back to become positive. Okay, let's say that this person is also the depressed, right? He the same person. When he hear about this instructor, right? That means the ear contact the voice, the eye contact. That means seeing the physical person, right? The mind pay attention. That means the brain pay attention to those two. That means the voice as well as the physical appearance. And you know what? The anger of the emotion it arrived very quickly because he or she have a lot of negative thinking in here. One, it becomes so strong, right? And at this moment, he be able to feel that in his face, he feel very hot, right? In the face. That means the heat on the face become very hot. He can feel it. and he feel that his hand is holding the fist, right? Holding the fist, and it's shaking. The body is shaking, also the hand is shaking. At this moment, if he recognize this kind of sense, um, if he recognize this kind of sign, right, from the body, and you know what, he and you know what, he be able to say, have a positive thinking like this. I know I am angry right now. I know I am angry right now because from the instructor, when he says something, right, maybe put her into him into the anger situation. I know I am angry right now. Anger is not me. I am not the anger. You know, that's what he this is what the thinking for the perception like that. That means I know I am angry. Anger is not me. I am not the anger. Why should I get angry? Why should I get angry? Okay. Once you have that kind of positive thinking, you know what? Then the tension of the anger will reduce very quickly or even disappear. Even disappear. This is the magic. I share this model to many people, and a lot of them can use it, and it works very well. In those situations when they get angry, they remember about to say like this: I know I am angry right now. Anger is not me. I am not the anger. Why should I get angry? Because anger is just the feeling. The feeling come and go. It's not us, right? Why should we get angry? Does it make sense to you, Sabina?
Yeah.
Good. So one we and you know what, and and one he have that kind of perception, thinking. He you know what, his anger tension reduce very quickly or even disappear, and therefore the mind and the body become very peaceful, right? He did not do any kind of any kind of negative action. Okay, that's important. So the thinking is so powerful. Okay, depend on what kind of thinking. In Buddhism, we know that karma, right, come from the mind, the mouth, and the body. That means the action of the mind, action of the mouth, and action of the body. The mind control the mouth and the body. Um, so when we say good or when we say bad, the mouth doesn't know this is good or bad, but the mind know. The mind know. That's what we call the intention. When the body acts good or bad, the body doesn't know this is good or bad, but the mind does know. So the mind is the most important. It's control the mouth and the body. So when we be able to change the mind, we change the mouth and the body action. Okay, that's important. Um, yeah. Okay. Okay. We okay. 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 We are okay. We are here, right? Okay. Okay. We done about this too. Okay. All right. Let's see. We go ahead. Do number two.
The second principle is that when you are feeling depressed, your thoughts are dominated by pervasive negativity. You perceive not only yourself but the entire world in dark, gloomy terms. What is even worse, you come to believe things are as bad as you imagine them to be. If you are substantially depressed, you will even begin to believe that things always have been and always will be negative. As you look into your past, you remember all the bad things that have happened to you. As you try to imagine the future, you see only emptiness or unending problems and anguish. This bleak vision creates a sense of hopelessness. This feeling is absolutely illogical, but it seems so real that you have convinced yourself that you're in a crazy will go on forever.
Good. Tell me what you just read. The second principle.
The more that you think negatively, it might change your perspective on everything
Mhm.
in a negative way.
Mhm. And that means whatever you see in the future
Is negative.
also negative. That's right. So it's important that we have to be very careful. When we have a negative, everything, whatever we see, always negative. So we have to be very careful with this thing. Okay, let's see. Okay. Okay. John, read number 3. Come.
Number 3.
Yeah.
Um, the third principle is of substantial philosophical and therapeutic importance. Our research has documented that the negative thoughts which cause your emotional turmoil nearly always contain gross distortions. Although these thoughts appear valid, you will learn that they are irrational or just plain wrong, and that twisted thinking is a major cause of your suffering.
Okay, good. Tell me what you what. Okay, go ahead and read this one too. Go ahead, finish the rest.
The implications are important. Your depression is probably not based on accurate perception of reality, but is often the product of mental slippage. Would you believe that? Would you suppose you believe that what I've said has validity? What good will it do you? Now we come to the most important result of our clinical research. You can learn to deal with your moods more effectively if you master methods that will help you pinpoint and eliminate the mental distortions which cause you to feel upset. As you begin to think more objectively, you will begin to feel better.
Okay, tell me what you just read.
That that the negative thoughts are, they're not like normal, and like it's a major cause of your suffering.
Okay. Mm-hmm.
And you could also feel better if you can pinpoint like your mental distortions or something that cause you to feel upset.
Mm. Yeah. So if you have the, you know how to train your mind to transform the mental distortion into the positive thinking, this will help us to help us to get better and better. Right? This is okay. All right. We stop right here. Um, uh, I promise you next time we will go into there are many 15 different type of distortion, uh, cognitive distortion. Okay, so we will learn about that. Okay, let's see. Victor, read this one. Go.
May every living being, our minds as one and radiant with light, share the fruits of peace with heart of goodness, luminous and bright. If people hear and see how hands and hearts can find in giving unity, may their minds awake to great compassion, wisdom, and to joy. May kindness find reward. May all who sorrow leave their grief and pain. May this boundless light break the darkness of their endless night. because our hearts are one. This world of pain turns into paradise. May all become compassionate and wise. May all become compassionate and wise.
Okay, thank you, everyone. Okay. All right, Nam Mô A Di Phật. Thank you, everyone.
Nam mô Phật.